My name is Amanda Sheridan, and I'll be presenting on Dr. Thomas Mütter. Okay, just a little history to start. Thomas Dent Mütter was born in Richmond, Virginia on March 9, 1811. His mother died shortly after of tuberculosis in 1813, and then his father died in 1817. He was barely 8 years old when he was orphaned. His brother and his grandmother both died within that time frame as well. Let's see. Mütter went to live with a distant maternal relative under whom he was well educated. In 1824, he started school at the Hampton-Sydney College of Virginia. He completed a medical apprenticeship with Dr. Sims before moving on to the University of Pennsylvania and earning his MD in 1831. At age 20, he became Thomas Dent Mütter, MD. At the time, Europe was the place to go to continue advanced medical studies. Dr. Mütter did not have much money, so he applied and was accepted to be a ship surgeon in order to cross the Atlantic Ocean. Once he made it overseas, he spent about a year in Europe studying under master surgeons Dr. Guillaume and Dr. Liston. As he studied under these doctors, Mütter became fascinated in plastic surgery, which by definition is cosmetic procedures to repair skin and tissue damaged by burns, tumors, or congenital defects. While in Paris, Mütter also obtained a wax model of a horned lady, a woman who had thick brown protrusion extending from her forehead to below her chin, which was the first specimen that he ever collected, and it's actually in the museum right now. This became the first of many wax models, skeletons, and body parts he would collect over the next decade. All right, in 1832, Dr. Mütter returned to the city of Philadelphia to assist Dr. Thomas Harris in plastic surgery. Upon returning, he had an umlaut added to his name to give it more of a European feel and sound, which now made him Dr. Thomas Mütter. I guess before he added the umlaut, it was Mutter. Now he's Dr. Mütter. Eventually, Mütter was asked to join the Medical Institute of Philadelphia as an assistant professor of surgery. There he used his growing collection of one-of-a-kind medical specimens as a teaching tool to demonstrate the various illnesses and diseases that could affect the human body. In 1841, he was appointed professor of surgery at the Jefferson Medical College in Philadelphia. At Jefferson, Mütter had a great reputation. He was an early adopter of anesthesia and sterilization, two developments which made operations significantly less risky and painful. They even sold tickets to watch his surgeries, where he was continuously praised for his skills, teaching, and even the specimens collected. He was a very strong advocate of the aseptic technique and was even one of the first surgeons ever to use ether anesthesia in Philadelphia. Dr. Mütter generally had poor health, and as he went on with his passion, dedication, and long hours of work and teaching, it eventually began to take its toll on him. In 1856, he resigned from his teaching duties and set sail for Europe in hopes that he would get better. Climate change, basically. Unfortunately, his location made no difference as Mütter suffered from painful attacks of gout and a recurring lung condition. He returned to the United States only a few years later. Once back in Philadelphia, in order to avoid the harsh, cold winter that was approaching, Mütter moved down to Charleston, South Carolina, where he died very shortly after, on March 19, 1859, at the age of 48. He was then buried in Middletown, Connecticut. Surgical innovations. Dr. Mütter was said to be far ahead of his time. When he started in plastic surgery, he repaired things such as cleft lips, disfiguring tumors, and disfigurations from burns. All things most surgeons at the time wouldn't even think of touching. He was a huge contributor to the skin flap technique in plastic surgery. At one time, he used a flap of skin still attached to its blood supply on the patient's back and brought it around to the front of her neck to replace the scar tissue that had tethered her chin to her neck from a burn injury. Once the operation was complete, the patient was able to turn her head, blink her eyes, and close her mouth for the first time in 2 decades. Mütter was also a huge advocate on sterilization and asepsis, which at that time was not regularly practiced. He had great bedside manner and always was very invested in his patients. Besides Mütter's dedication and advocacy of anesthesia, sterilization, and medical asepsis, one of his biggest contributions to the history of medicine is all of his specimens that made the Mütter Museum even possible. Before he died, Mütter had made known that he wanted his specimens housed in a fireproof building. His first choice was Jefferson Medical College, but they weren't too keen on the expenses involved. Mütter then turned to the College of Physicians, which isn't so much a school but a professional medical society that was founded in the 1700s. He offered them $30,000 along with his entire collection of 1,700 specimens at the time for the society to preserve and display. It took a few years, but the Mütter Museum officially opened to the public in 1863, which was about 4 years after Mütter passed. Since then, the Mütter Museum has collected over 25,000 specimens and more recently acquired a section of Albert Einstein's brain. Pretty cool. Here are some examples of the oddities that fascinated Mütter. Some he collected and some that were collected after his passing by donation, and they are all currently on display at the museum. So first, all right, gout hands. This is actually from Mutter's personal 19th century collection. This is also something that Mütter personally suffered with. But yeah, that's gross but cool. Let's see what's next. Let's see. A wet specimen. This is a colon infected with dysentery, which is a common illness in the late 19th century and early 20th century. All right, and last we have stillborn conjoined twins from the 19th century that were donated to the museum by staff from an anonymous medical school. And here are my references, and that's it.